Hi everyone, welcome back to my channel. My name is Rhoda and I'm a doctor working in the UK, and today is a really exciting video because I'm going to be taking the camera behind the scenes and show you what a typical day of a doctor is. So for those of you who don't know, I'm a GP in the UK, or a general practitioner, or a family physician if you live elsewhere. I'm going to show you what happens behind closed doors of a typical day. So a general practitioner is a type of doctor who's a generalist and pretty much sees everything. So this incredible variety when it comes to the type of patients that we're seeing. We see anyone from 3 weeks old all the way up to 100 years old. The day is broken down into a morning session. So this is where we primarily see patients. At the moment, because of the situation, they are face-to-face and some of them are remote, so via telephone or what's called e-consultations. The morning session tends to end at around 11:30, 12 o'clock. Then we have about half an hour of what's called admin time, which I'm going to be explaining later on in the video. Then another half an hour of lunch, and then we crack on with the afternoon session. And that's again seeing patients. And for me, this typical day, I was seeing patients up until 3 o'clock. Then I had another hour or so of sort of home visits and administrative things. And from about 4 till 6 o'clock, it was what's called acute practice work, which is where we see emergency patients or anyone who really needs to be seen on the day. And that can be very varied as well. Then the day wraps up at around 6:30, 6:45. So grab some popcorn, have a drink, have a cup of tea, get yourself comfortable, and I hope you enjoyed this video. Without further ado, let's start the video. So this is a typical GP room. So you've got the desk, computer, where we access all the patient records. I've got all my equipment there as well. The room looks a bit messy actually. Sorry about that. I should have probably tidied that up before I started filming. I've got the examining bed as well, which is where we carry out any sort of physical examinations. So I've just finished my morning surgery and it's 10 to 1. I'm just about to go on a home visit that's just come through as an emergency. So there was a patient recently discharged from hospital with unfortunate underlying cancer that seems to have spread. So because of that, they've been experiencing a lot of symptoms. Myself and another doctor are going to do the home visit and just to see what the patient is like and what we can do to try and help alleviate these symptoms. So I'm going to do that. I'm going to quickly grab a drink before I head off, and then I'll probably catch you later. I've got some allocated time for administrative stuff in GP. So in addition to patient care, there's also a lot of admin type stuff, so a lot of paperwork, and that can be in the forms of blood test results that need reviewing for patients who've been sent for blood tests for various reasons. That can include reviewing scans that we've sent the patient for, so any x-rays or ultrasounds or endoscopies, and reviewing that, and also looking at letters, things like discharge letters. So when a patient's been admitted into hospital and they've been discharged, we also receive a letter, so making sure that if they've been diagnosed with a new condition, they may have been started on new treatments that we need to know about, medications may have been changed that we need to action, and also letters from specialists. So again, if a patient's been diagnosed with a new condition, if we've sent a patient to the gastroenterologist, so that's the stomach doctors, and we were worried about something called Crohn's disease, and then they've been diagnosed, we need to know about the medication that they're going to be on. And then there's also the other kind of miscellaneous type tasks. So any sort of prescription queries from patients and from the pharmacies about the patient's medications, the doses, whether they're on the right treatment, whether we need to change it. So that also takes a little bit of time in addition to the actual face-to-face and, you know, speaking to the patients. I mean, an example is I referred a patient with severe eczema that we've been treating for quite a long time, but doesn't seem to be working, and their eczema is still pretty bad. So at this point, I think they need to be seen by a dermatologist, so skin specialists, for more advanced treatment. So things like immunotherapies in severe eczema, so things like that. got this 37-year-old gentleman with a 1-day history of acute epigastric pain that seems to be radiating into the right upper quadrant. I wonder if you'd be able to assess this gentleman, since I'm quite concerned about potential cholecystitis or even a perforated peptic ulcer of some description. Thank you, thank you. So one of the tasks of a GP is being able to assess patients and decide whether or not this person is someone that can be managed within the primary care service, or they may need further interventions. So that can be in the form of a hospital admission to have more intensive treatment, so if it's antibiotics through a drip, for example, or they may actually need surgical intervention. So with this patient, I was quite concerned about very, very tender when I was feeling the stomach. So that was starting to worry me a little bit. So I thought, this person needs to be seen in the hospital. Quick coffee break. Hello, this is Dr. Abdi, one of the doctors at the surgery. Yeah, I just wanted to discuss the blood test that you had done recently. There was just a few things that I just wanted to go over with you, if that's okay. We use a specific software to help us document, so basically write down what the patient came in with, any sort of examination findings, what we're thinking is going on, and what the plan is that we've agreed with the patient. So I just thought it would be a good way to give you an insight into what kind of general practice is about, and what kind of working as a doctor, a family doctor. Keeps you busy, and I like the variety to not get bored. And yeah, let's get home.